assessment. Our scenario is that Constance Harcourt, age 84, is admitted to the medical surgical unit with heart failure. She complains of fatigue, shortness of breath, and a 10-pound weight gain over the last 3 days. We will begin our assessment with the subjective data portion.
Hi.
Hi.
My name's Andrea. I'm going to be your nurse today. What's your name?
Okay, Constance.
Perfect. And what brings you in today?
I'm having a lot of chest pain and shortness of breath
Okay.
and fatigue, so I just wanted to get it checked out.
Okay, perfect. Well, I have a couple questions for you to go through a little bit of an assessment.
Okay.
Can you tell me your name and your birthday?
Constance Harcourt, 10/02/34.
Perfect. And do you know where you are right now?
I'm in the hospital.
Okay. And what holiday is coming up?
Thanksgiving.
Perfect. And so you said you're having a little bit of chest pain?
Yes.
Can you describe that for me?
It just feels like really tight.
Okay. And does anything make it better or worse?
It gets worse when I start moving around.
Okay. And does the pain radiate anywhere, or does it stay in the general area?
It just stays
Okay.
in the general area.
Can you tell me which side of your chest it's on?
It's kind of all over.
Okay.
Yeah.
Okay. And can you rate the pain on a scale of 0 to 10 for me?
It's like a 6.
Okay.
Yeah.
And how long has that pain been present?
Like a week, I would say.
Okay, so on a scale of 0 to 10, then what is the normal pain level that you can tolerate with it?
It's been like a 4.
Okay.
Yeah.
So it's just a little bit of an exacerbation. That's what brought you in?
Yeah, it's just gotten worse over the past couple days.
Okay. And then you said you're experiencing some shortness of breath?
Yes, and it's especially bad when I get out of bed and start moving around.
Okay. And
Yeah.
is there anything else that makes it even worse?
When I lie like flat, it's really like uncomfortable for me.
Okay.
So.
And are you a smoker?
No.
Okay. Do you drink at all?
No.
Okay. Any use of hardcore drugs or anything like that?
No.
Okay. And have there been any changes in your energy levels?
I'm so tired all the time. I do not have the same energy I had a little bit ago.
Okay. And how long has that been going on?
About a week as well.
Okay.
Yeah.
And do you ever get dizzy at all?
Not really.
Okay. You said that you've gained a little bit of weight?
Yes, I've gained 10 pounds in the past 3 days.
Oh, wow.
Yeah.
Okay. And have you noticed any swelling in any of your extremities?
I think my feet and ankles are pretty swollen right now.
Okay. We'll take a look at that.
Okay.
And then have you had a cough at all?
No.
No? Okay. And are you up to date on all of your current vaccinations, your flu shot, your pneumonia vaccine?
Yes.
Okay. And do you have a history of any childhood illnesses?
No.
Okay. What about a history of any hospitalizations or surgeries?
No, I did have 2 pregnancies, but I carried to term and they were totally healthy.
Okay. And natural birth or C-section?
2 natural births.
Okay.
Yeah.
And do you have any allergies
No.
that you're aware of? Okay. And then what medications are you on?
Here's a list of all my medications.
Oh, awesome.
I brought that from
Thank
home.
you. Does you or your family have any history of chronic illnesses or anything?
My father died of a heart attack.
Okay. And that's all that you're aware of?
Yeah.
Okay. And do you have a history of any hypertension or high cholesterol?
No.
Have you had a hard time sleeping?
I just find it so uncomfortable to sleep and I can't lie flat, so yes, I have had a hard time sleeping.
Okay. And have you been urinating frequently at night?
No more than I normally would.
Okay. About how many times do you think?
1 or 2.
Okay. And do you live alone or do you live with someone?
I live alone, but I have a dog.
Okay. And do you feel safe in your environment?
Yes.
It's a safe area?
Yes.
Perfect. And are you able to do your daily activities, going to the bathroom, cleaning, cooking?
Yes, and sometimes my kids help me out too.
Okay. And do you shop for yourself as well?
Yes.
Okay. How close do your kids live?
10 to 15 minutes away.
Okay, perfect. So you have some family support there.
Yes.
And you have no other issues with your daily activities?
No.
No? Just recently with the shortness of breath and everything?
Yes.
Okay. And do you have any other self-care activities that you enjoy doing?
I like to walk my dog and spend time with my grandkids.
Perfect. All right, well, that's all the questions I have for you. I think another nurse is going to come in and take a little bit more of your vitals and see a little bit more of how things are going, okay?
Okay.
All right, and here's your call for you. Just call if you need anything.
Thank you.
We will now move on to the objective data portion of our cardiac exam, which includes inspection, palpation, and auscultation.
Hi there, my name is Acamio. I'm going to be your nurse today. Can you give me your name and date of birth?
Constance Hartford, 10/02/34.
Okay, great. And I'll check your wristband. All right, I'm just going to take some vital signs first.
Okay.
So we're going to get you on the pulse ox here. See how you're doing with your oxygen. This one go. Your finger, please. Thank you. Well, it looks like your oxygen is a little bit low. I'm going to go ahead and put you on a little bit of oxygen. Is that okay?
Okay.
All right. Go ahead and put those little prongs in your nose. Those right over your ears. Let me know if that's uncomfortable for you, okay?
Okay.
All right, let's take your temperature. Okay, great.
What do you want to do?
All right, so it looks like your oxygen level's a little bit better. Feeling a little bit better?
Yes.
All right, we'll go ahead and take this off. Now I'm gonna go ahead and take your pulse, but first I'm gonna raise the bed up a little bit so it's easier for me to get to you. Color looks good, everything looks pretty nice. I'm just gonna pinch your finger here. And can you go ahead and do this for me? This tells us if you've got any clubbing in your fingers, whether you've had oxygen deprivation. All right. Everything's good. Okay, and now I'm gonna lay you back a little bit, if that's all right. Are you able to be back or do you need to sit up?
Maybe, I think with this it'll help, so not too far back.
All right, so we'll leave you up as much as we can.
Okay.
All right. See, you got a little bit of swelling here in your feet. Has that been going on for a while?
Yeah, about 3 days.
I'm gonna take your pulses.
It's just on the video, so just like, just yeah, the video or like the photo. Yeah. I was gonna do like just a quick like clip of them, but we could do a photo if you want.
Now I'm gonna sit you up a little bit if that's okay. I'm gonna check your neck vessels here. I'm gonna listen to your neck to see if there are any extra sounds.
That's a good floor. As long as you don't want to use But let us know if you need help though. Alright, I'll let you guys know.
Okay, everything sounds great. Now I'm just going to listen to your heart.
Okay.
Now I always listen to the heart in a number of places, so just because I'm listening for a while in different spots, it doesn't mean that there's anything wrong.
Okay.
Sometimes people get worried. Alright, I'm gonna leave you sitting up for this part. Is it okay if I move you down?
Yes.
Sounds good. Now I'm just going to feel at the apex of your heart right now. So if you could turn over on your left side for me. Just put your arm right like that. Perfect. Okay. And then I'm going to have you sit up and lean forward for me. Okay. Or listen to see if you have any murmurs in your heart, any extra sounds.
Okay.
Okay. Lean forward a little. All right, so how is your breathing?
It's a bit labored.
Okay, well, I know that you've had some history with heart failure, so I'm going to go ahead and take a little listen to your lungs.
Okay.
Just go ahead and breathe in and out. I'm going to move your gown here. Are you doing all right there? You're not getting lightheaded?
No, okay.
Can you sit forward and lean forward for me? Thank you so much. I'm going to move your hair out of the way. Okay, breathe in and out. All right, one more. All right, thank you. All right, go ahead and get comfortable. Lower your bed back down so you can get out. And thank you very much. Did you have any other questions?
No?
All right. Here's your call light. Thank you very much.
Based on our patient's assessment, we've established a few different nursing diagnoses. The first one is that excessive fluid volume related to decreased cardiac output as evidenced by 10-pound weight gain. Impaired gas exchange related to ventilation perfusion imbalance as evidenced by a pulse ox of 94% on 2 liters of O2 via nasal cannula and complaints of shortness of breath. Our last nursing diagnosis is decreased cardiac output related to peripheral vascular resistance secondary to hypertension as evidenced by a blood pressure of 178/98 and complaints of fatigue.